Welcome, everybody. My name is George Espenson. I'm Hennepin Healthcare's outreach person for the Trauma Center. And today we're going to be talking with Dr. Ashley Strobel, Director of Pediatric Emergency Education. And Dr. Strobel, first of all, thank you for the value of your time. We really appreciate it. Let's start off just a little bit and maybe just tell us briefly a little bit about yourself and your family.
Yeah, well, thanks for having me. So I am Ashley Strobel, and I work at Hennepin County Medical Center in the emergency department. I've been here for about 5 years, and I also spend a quarter of my time over at University of Minnesota Masonic Children's Hospital. So I came here from Baltimore, Maryland on the East Coast, where I trained at University of Maryland at Shock Trauma Center. And then prior to that, had done medical school at St. George's University in the Caribbean and did my rotations in the South Bronx at Lincoln, a large level 1 trauma center in the Boogie Down, and got to see Elmhurst Medical Center as well in their trauma center. So that's a little bit about my background.
Very good. Thank you. And what brought you to HCMC? Obviously, a person of your immense talents can kind of pick their own ticket, but what brought you to Hennepin?
Well, we looked all over the place, and something about Hennepin really spoke to me. And so it's just a very unique place where I feel like emergency medicine is still very pure and what it always has been. When someone comes into our emergency department, we like to take care of it in-house for them. We try to call consultants and have our colleagues come down when we need them, but we also try to take care of things so that they can continue about their other work. And I think one of the coolest things is that we see patients age 0 to end of life in the same emergency department. So we can take care of a whole family right there, even in one room. And your whole family can kind of stay together, and after you have your baby at Hennepin, then your kiddos can grow up in pediatrics at Hennepin, come through our emergency department for their mishaps, and then grow into and still come back to where they feel is home. And it has a home feel because it's just the people and the attitude and the care that's provided not only to our patients, but to each other and our other colleagues.
Very good, very good. And when you think about your time at Hennepin, sort of what is the typical pediatric trauma patient that we treat? I know a lot of people think of us for the really, big, obvious trauma stuff, but what's kind of our typical pediatric trauma patient profile look like?
Our pediatric traumas run the gamut. You might have a minor slammed finger in the door, which doesn't seem so minor to a parent whose little kiddo's finger is bleeding. But we'll take care of things in our pediatric area of our emergency department. And then we can have kids who are involved in a very bad motor vehicle accident that go into our stabilization room. We can have kids who have a fall, horseback riding accidents. In the winter, we've got skiing and snowboarding and your snowmobiling. And then in the summer, we have all of our other sports that everyone's playing in Minnesota, and boating accidents. But then we also have other things that may not seem like they're trauma, but just something may seem like, how did this happen? So we take care of folks who have suffered abuse, babies who have suffered abuse, and injuries in all manner of ways. And we take care of folks who are in a car accident who can walk in, and folks who can't walk in.
Sure. And, I think most people know about our, national leading trauma outcomes for both pediatric and adult. And when you think about pediatric, why do you think we're so darn good at it? I mean, why do we consistently year after year after year rank in the top less than 1% of pediatric trauma outcomes?
It goes back to the same reason that I came here and the same reason that I really love working at Hennepin. And it's that close-knit community feel. we're like a family, and the care is very much like that. Every patient that comes in the goal is to treat them like they're part of our family. And from start to finish, from first responder, EMS, state room, and then on to the operating rooms and the pediatric intensive care unit or the pediatric floor, and then finally with rehabilitation and outpatient follow-up. It's just a really great team of folks who are trying so hard and doing their best, and at the same time making advances in pediatric trauma care. Always trying to stay cutting edge from our radiology department, doing the images with the lowest radiation that's allowable to be able to get our pictures. We've got specialists like Child Life who help to make the visit a little less scary for families, and then just excellent nursing care throughout the entire continuum. And I think it's that close-knit feeling, working very well together with teamwork every step of the way, with prompt care, really looking and frankly, trauma is what we do. That is our specialty. And although kids are not little adults, with its trauma care, it's rather protocolized. And if you're doing the same thing over and over and over multiple times a day, of course you're going to be extremely good at it. And that's what we do. And that's why we excel at both pediatric and adult trauma care.
Yeah, I think those are great points. When you think about pre-hospital and the role that EMS plays and all the first responders, because obviously they're very integral to the survival of patients before they get to us, what things would you say to the people that are watching that are particularly useful in pediatric trauma pre-hospital care?
Well, first of all, pediatric trauma is tough. You may come on scene and it may seem like something minor for trauma, but still always going through your algorithms, your ABCDE, and following protocols is important. And then when it's a bigger trauma and the child is in a life-threatening situation right then and there in front of your eyes, it's challenging, right? So we have to go back to all of our basics and make sure that we're using the right size equipment, the right amount of medication. Getting access is difficult in these kids, but really doing all of our steps in our protocolized care that we would for adults, for kids, and then having great communication as you're coming on in or letting us know in advance. Because just like when you hear the call and you head out and you start thinking about your drugs, okay, this med is this much and this is what size this equipment I need, and you're getting everything ready, that heads up that you give us allows us to get the next steps ready in the chain of care. So you folks integral and important. Families look to you and they think, this is the worst day of my life. Please just make it better. And the first thing that you can do is just greet them with a smile and say, we're here to help. And then, make sure that they get to the best place possible. And again, we do have the best outcomes for pediatric trauma care nationwide. And so certainly, if you let the families know that they're going to get some great care at our level 1 trauma center, I think they'll feel just absolutely relieved to know that their kiddo is going to be well taken care of by you. And then the next folks who you have said are going to be wonderful to help them through this process.
Yeah, I think those are great points. And then finally, as we wrap up, being mindful of our time, do you have anything else that you'd like to say to our EMS referral agencies?
I think everyone thinks of Hennepin for pediatrics as the place you go when you think the kid might not make it and this is really bad. We're going to be in the save room 24/7. We're going to greet you with a smile. We're going to take the equipment and help you out and get folks transferred over. You know that we have the best airway equipment that's out there, and we'll promptly manage any airway, no matter how difficult. You know that we have ultrasound capabilities, and you know that we speak that language. So if you have ultrasound on your rig, you know that we know what you're talking about. Also, I want you to think about us, though, for everyday trauma. Sometimes we forget that when a kid falls down and bumps their elbow, that's trauma. So, for instance, I had a kiddo who suffered a skate to the upper abdomen in a hockey game. Seemed probably minor at the time. Wasn't complaining much, but this is a pretty stoic kid, and so you have to know normal development and really kind of get some time with that kid to have a better assessment. They went to an outside hospital, got a partial FAST exam that wasn't complete, and then a few days later, called again, after discharge, called again 911 for shortness of breath. And they were reassured, hey, kid got bumped in the belly, probably it's just a little diaphragm injury. And you know what? That person was right. But then the next day, when mom got home from her vacation and saw the kid, after not having seen that slow progression that the other parent was seeing, but seeing them fresh, said, oh no, this is not right. And when that child was brought into me, I knew what the first injury that kind of trauma could have and what we needed to assess for. I was worried about a pancreatic injury, and that's exactly what this little girl had. After the CT, we showed transection of the pancreas, and she ended up staying in the hospital for a couple months, actually, and it really affected her friendships with other kiddos and then her growth and development at that age. And so we really want to make sure that we try to not have delayed diagnoses or misdiagnoses by making sure that we're doing a very good, complete trauma evaluation of children. And so going somewhere where we know kids, but we also know great trauma care, so we know what to think of. So while that kid walked into the emergency department, they were extremely sick, and it looked like just a minor kind of bruise on the belly. So we're here for all sorts of trauma. We can decide, is this minor or major? And even if it seems minor, we probably have some outpatient resources to help the family. So for a lot of our kiddos who suffer a TBI, we will have PT, OT, social work see them to make sure there's school notes for sitting out, to make sure that they're going to get some outpatient resources for cognitive assistance, and then symptom management in our pediatric TBI clinic. So all of these things Hennepin has to offer for the whole range of pediatric trauma. So
that is fabulous. Well, thanks again for taking time out of what I know is a very busy and hectic schedule at Hennepin. Always everyone's running, lots of things going on. And we really appreciate your time today. So thank you very much.
My pleasure. Thanks for having me. And any further questions, don't hesitate to reach out to me. It's ashley.strobel@hcmed.org. And then also feel free to say hi in the save room or in the team centers if you see me nowadays with the